David, thanks. Flu cases continue to climb, sending more patients to doctors' offices and hospitals.
Medical experts, of course, say knowing the warning signs and when to seek care can make a big difference. Victoria Frazier is in the studio after talking with a local doctor about just those issues. Victoria?
Yeah, Chris, this is a respiratory illness dashboard on the Wisconsin Department of Health Services website, taking a look at numbers across the state. Now, we're seeing very high activity based on emergency room visits, but those numbers are decreasing. Now, I'm going to switch over to Northeast Wisconsin's region. You can see here that the numbers are still pretty high, very active numbers, but those numbers are also increasing. Doctors say it's not too late to protect yourself and others.
While the holiday season is behind us, doctors say they continue to see the side effects of those large gatherings, with an increase in emergency room visits for cases of the flu, and one strain more common than others.
Influenza A has been the more aggressive and more prominent of the strains of influenza, and that's really geographically the same.
Dr. Matthew Freeman, along with other medical providers at Green Bay ER and hospitals, say they are seeing more cases in elders and children as they return to daycares and schools.
You're having exposure on a regular basis to people who are not always cognizant about washing their hands or covering their mouth, and there's such an easy spread of this particular disease process during the winter that we're all at risk.
While flu symptoms can mirror that of a cold or COVID, the influenza A strain has more severe side effects like vomiting, body aches, and a fever. But Dr. Freeman says, when in doubt,
seek help. Seek out a professional, whether it's calling our hospital, having a conversation with a nurse or a doctor, or just getting up, getting yourself so they can see you in person, take your vital signs, assess you fully to make sure that something more sinister isn't going on with your body.
Now, doctors say it's not too late to get the flu shot and recommend washing your hands often, wearing a mask, and staying home if you feel sick to help prevent spreading germs to others. Chris?